Yeah, I was part of a group, I don't know if you remember me, in the beginning of this, that was saying we do need the government to help us out as insurance companies, and I'm an insurance agent, to control costs, and there are a few people that are slipping through the system we need to address. $3,000 a family a month is crazy. We got to deal with that. Okay, everyone was on board for that. But this runaway train that took place afterwards, a 2,000-page bill, it really has nothing to do with either of those issues as far as I'm concerned. It is just a power grab. And it's like Cobra. Cobra's 1,500 pages, correct? Okay? And it was supposed to help people with insurance between jobs, correct? That was the lie. The truth of the matter was, if you really had wanted to do that, instead of putting fines and fees and lawyers all over employers, so that they have to do all this notification and they have all these penalties if they screw up, just like this bill. It's the same kind of nonsense. I spend $20,000 a year on lawyers to protect my clients from Cobra, from from the Cobra laws. And instead of that, one paragraph that said when someone leaves a company, the insurance company, which are billing machines, must send them an offer for an individual policy at a decent price. That was all you had to do. It would have been 1, 2, 3 pages at most, not 1,500 that the lawyers don't know what was written. But what it did was it gave the congressmen and senators that wrote it a job when they left here, interpreting the law they wrote that was ridiculous. Okay, this is the same thing. It's overkill. If Senator Webb wants to run for president one day, what he needs to do is jump out in front of this and say, look, everyone had the right intentions, the right motives, but this thing's out of control. I'm pulling out of it, and I'm going for baby steps. I'm going for tort reform. I'm going for, I use the analogy, when I started in the business, prescription drugs were 3% of your premiums. Today they're 28%. What happened in between is we allowed them to start advertising to the general public with all these disgusting commercials none of us want to watch. Okay? If we put it back, if we put the genie back in the bottle, it would not go back to 3%, but it would come down 10, 15% off of where it is, and those would be real savings. That's the kind of stuff we need to be test marketing in states. We've test marketed most of this bill in places like Massachusetts, which is bankrupting Massachusetts.
Yes.
Okay?
California.
Yeah, everywhere this stuff has been done, it fails, but let's do it again. And let's do it bigger. You're gonna speed up the demise of Social Security and Medicare. You want to know how? A hospital has 3 ways to get money: Medicaid, Medicare, private industry. Correct? That's only 3 sources, and chase a few people for their own money. But by and far, all their money comes from those 3 sources. Medicaid and Medicare, you walk in and you say, you will take this, and there's no negotiation. And you're paying these doctors and hospitals less than the cost to do business. So they come to us and jack up the rates. Everyone that has private insurance is paying $150 a month per family of 4 for Medicare. Okay? That's in your premiums, okay? That cost shifting onto us, if you wipe us out, is going to go away. And then all the doctors and hospitals are going to shut their doors or say, hey, we want 50% more out of you guys. Okay? And we're going to get it, or we're going to all go on strike. I mean, this is just a disaster taking place.
This is a doctor's home.
Yeah, can I just ask one question? In your experience in the insurance business, for a typical family of 4, you mentioned Medicaid, that there's a certain cost for that family. What about the uninsured? How much of the cost that, for hospitals and uncompensated care is reflected in that? Do you have a sense of that?
It's in the low single digits. I mean, that's been blown up into this giant mushroom cloud that it's not. And frankly, you could address something like that far easier by just saying, at the emergency room setting, if somebody walks up, they get triaged. And if they have the flu, you have an urgent care facility right next door that you say, hey, no offense, but you're not dying. This is an emergency room. The urgent care facility's right there, and oh, by the way, it's only $50 to get your care there. Have a nice day. And you can triage them out of the system, and then the kid who's really bleeding to death, nobody wants us to see him bleed out. Everybody wants him taken care of, right on the spot. But that could all be done at a very quick point in time, and we would not have to have 2,700 illegal Mexicans filling our emergency rooms every night getting free health care. If you pushed them into this urgent care and they had to pay $50, they wouldn't bring their kid. They'd do like the rest of us did and wait till he gets better. Because it's just such a Yes, Manassas.
We have a doctor.
Hi, who am I talking to? Not Paul Reagan. Yeah, I talked to you before, Paul. Hi, Howard Sachs. I am so passionate about this. I'm beyond words about how unwise this thing is.
Yes.
This has a lot to do with smarts, and I've learned in life, now that I'm 54 years old, that smarts has very little to do with wisdom. You've got a lot of smart people, lawyers with law training, writing 2,000 pages of bills, with 6,000 subsections of laws, with 50 new agencies, with tens of thousands of new bureaucrats coming here to control our lives. It is going to wreck our liberties, it is going to wreck our economy, and it is going to wreck medicine. Medicine is going to be turned into the Department of Motor Vehicles Medicine. Department of Motor Vehicles is what you're going to get. You say, Howard, Dr. Sachs, give me 3 examples. I'll give you 3 quick examples. Government already runs half of the show of medicine. You all know that. They have filled my shelves with regulations. I have a shelf for mammography. We have well-intentioned, smart people in this government. I don't know about you, but they're very kind. They're well-intentioned. They've gone to Princeton and Yale, and they are smart, well-intentioned, but they have little wisdom. They fill my shelf with rules about how to do mammograms, and then they say the government runs things so efficiently. Medicare only has 4% administrative costs, but they're little children. They don't realize that every sentence in these 2,000 pages and every paragraph in this works its way down to me, and my office is in Virginia and Maryland and DC, and they run my lives, and they make me spend lots of money following their regulations. Well, what we did is, even though mammography is a great thing to do, we stopped doing it because it's, and they send me letters every year, like you're about to send me another one. Medicare rates are going down by 20% this year, 12%. These are children. They don't care. They don't ask me that it costs $300,000 for a digital mammogram machine. They don't care that it costs $75,000 for a good, high-quality tech. They're well-intentioned. They're government. We have good feelings. We're Mr. Obama. We want health care for everyone without
We're
caring
here to
for
help
price.
you.
One last thing. You did my mother. My mother has $2.5 million in the bank. She and my dad have sweated and worked very hard. My mommy doesn't need a Medicare card. She can pay for her own medicine. I want to help poor people that have nowhere to go. What do you think it does? Mommy spends all day in the doctor's offices because it's free.
Bingo.
It's free.
Absolutely.
Thank you very much.
Thank you.
I pray this senator has 1 ounce of wisdom.
Amen.
And this is also an opportunity for actual leaders in the Senate to step up and be leaders.
Exactly.
Instead of just be pushed around by
And
their
brought out.
party leadership.
We want
Take
this
the
to work.
center.
We want this to work. This is what we've known all our life.
Maybe we could make a couple of general comments, and then, first of all, with respect to the procedure, I think that the leadership and the administration have followed throughout this process. Senator Webb's been fairly consistent and fairly critical of that process. He felt it should have followed a course where the administration proposed legislation that everybody, citizens, stakeholders could look at, have hearings on, which is sort of the regular legislative process. And he's been fairly consistent in that view. That's not how it happened, and we are where we are. We are working to try to make sure that the process is as open and as fair as possible. He was one of 10 senators in the fall who sent a letter to the leadership of the Senate requesting or urging that the bill, when it was completed, be posted on the website, and there would be ample time for all citizens, including stakeholders and citizens and other lawmakers to read the bill.